Living lovely.
Happy Friday.
Happy Friday. So today we have a wonderful patient, 59 years old, and she'd lost a moderate amount of weight, and she's had 2 pregnancies, and what we're going to be doing today is a mommy makeover. So what we're going to be doing is a tummy tuck, getting rid of excess skin and fat of the tummy, placating the rectus muscle, reorienting the belly button, lifting and reducing the pubic region, and a breast lift or a mastopexy anchor by making an incision around the areola down and under to get the nipple areola complexes back to where they were, and also doing liposuction in the back here to get rid of some of this excess fat on the middle back and upper back. So you can see the rectus diastasis here on profile. The rectus muscle has been distended. The muscles have been then separated. So with the repair of the rectus muscle, we're going to flatten the abdominal wall by getting that nice and flat. So let's go to the operating room. I'm going to show you how we do a mommy makeover and liposuction in the back.
Living lovely. I wanna be with you. I wanna be with you. I wanna be with you. I wanna be with.
So we did 3 areas here: the upper back, middle back, lower back. Upper back, a little bit less fat compared to the other areas, but we flattened that down. Remember those rolls she had before the surgery? Those rolls are gone. I lipoed above it, I lipoed in it, I lipoed right below it. And then we sort of snatched her waistline. Most of her fat was down in the lower back. You can see she has a much better contour and a much better hourglass shape now, having lipoed sort of this area here and this area here. So this is loose skin, which we're going to snatch with the tummy tuck from the front side. But now she has a nice, much smaller back, and those back rolls are gone. So now we're just going to flip her over and do the tummy tuck and then the breast lift. Start on the abdominoplasty or tummy tuck. I'm going to make my incision low here. Dissect up to the belly button, unbutton the belly button, go clear up to the sternum, identify the rectus abdominis muscle, fix the rectus diastasis, placate the muscle together. From that dissection, ideally we can get the skin, pull down to there, really flatten her tummy and bring this skin down.
Only for life, let's get it. Hit that shoulder lean. I know what coming over me. Backstroke overseas. I know what you need. Already on 10, already come in.
All right, so I did my lower incision here, pubic region, down to the rectus fascia, went up to the belly button, unbuttoned the belly button, went clear up here to the xiphoid bottom of the sternum, that's the rib cage. Underneath there is her heart. And you can see the paired rectus muscle here and here. She has a little diastasis, separation of the rectus muscle due to her pregnancies and weight loss. So what I'm doing now is I'm finding the midline. Diastasis, fancy word for separation. Okay. So our wonderful anesthesiologist has given her medication to help her become paralyzed. Okay, so she's on a breathing machine, so the machine's breathing for her, so that's not a concern. You can see her heart, you can hear her heartbeat in the background on the machine, but the paralysis of the muscle allows a very lax muscle. So now I can really tighten this up. If she was under light anesthesia, the muscle would still resist us and contract and lead to a substandard tummy tuck when we do the rectus repair. So let's get a measurement here. The muscle is about 14 centimeters apart, or for you inches inclined, about 5.5 inches, something like that. And I think probably, let's go 3 and 3. So 3 centimeters is there, 3 centimeters is there. So natural border rectus abdominis muscle, we're going to placate this, get this together, and I think she'll get a very good result. This is Marcaine. This is a anesthetic. One of the things that hurts from the tummy tuck is the rectus plication, which we're just about to do. So I just inject this product called Marcaine. Marcaine is like lidocaine, Novocaine, and it numbs up the rectus muscle. I put it underneath the fascia, so it does a couple of things. It's right on the muscle, and it also helps with placement of the sutures here by separating the fascia from the underlying muscle. Pretty straightforward bringing. You can automatically see how that brings in her waistline, more of an hourglass figure. The snatch suture. So I made my low lateral high tension abdominoplasty incision low in the pubic region, and then it extends high out over the hips, If we were just doing a horizontal tummy tuck, the incision would be a little bit higher in the middle here, and then just go straight out over the hips, or a little bit curvature to the hips. But this goes really high lateral tension tummy tuck. Go down to the rectus fascia. Again, I plicated it, made an incision around the belly button, pushed the belly button in so it preserves its blood supply like a little volcano. Went all the way up to the sternum, bottom of the rib cage here, with my plication double layer permanent suture. You could bounce a sterile quarter off it. It's nice and tight now. Remember how loose it was at the beginning before we plicated it. And we brought it in a good 6 centimeters. So now with that rectus plication, the repair of the rectus diastasis, and the release of all the soft tissue and cutaneous tissues, we're able then to take the tummy, which is like this. Again, the incision is there for the belly button, and I'm able to pull this extra skin down. So it's not that I'm bringing the pubic region up, it's I'm bringing the tummy down. So we're going to pull that down to about there and get rid of all this excess skin for her. Okay? What I've done is I've marked out what I want to resect on the tummy. This is the specimen. Again, that's where her belly button was. And I use these towel clamps to measure the tension on the flaps by reapproximating the upper flap to the lower flap where these other towel clamps are. So there are 21 clamps above, 21 below. We matched them up, we felt the tension. And this is the amount of skin and fat that we can excise. So pretty good amount of skin. It's about 2 hand breaths out. So she's going to get an excellent result. Again, we're doing a high lateral tension tummy tuck. And now we're just going to resect the skin and fat. So we're done with 4 parts of the abdominoplasty or the tummy tuck. I got rid of the extra skin. I got rid of the extra fat. I plicated the six-pack muscle. I lifted and reduced the pubic region. But what's left? The belly button. So you can see the belly button is inside. This is just the way I do it. This is just the technique that I do. So she was flexed to allow our closure. Now we're going to lay her flat and reposition the belly button. So the belly button is at a line intersect from her midline, which is right here, and then a line from the top of her iliac crest right here. So her iliac crest is right here and here. So we draw a cross line there, and the belly button will be right there. But before we do that, we'll flatten her out. To mark out the belly button, we find her midline here. I use this midline suture sort of as a plumb line, if you will. That is her midline. We mark that out with a purple line, so that's her up and down vertical line. And then you draw a perpendicular line from the top of the iliac crest. Her hip bone's right here. I'm feeling for the hip bones right there. I bring my line across, and her belly button should be right there. That'll be the 6 o'clock position of her belly button. Pretty much everyone's anatomy is like that. If your belly button is higher or lower, it's not normal. So that's where her belly button should be. And now let's go fetch. So I think it's probably going to be a little bit lower. I'm feeling for the, again, the top of the iliac crest, the top of your pelvic bone, drawing a line sort of straight across. I think it should be right there. And then you sort of eyeball it. Is that the way it should be? Yep. Should be sort of right in there. Remember, we tagged that belly button with a green stitch at 6 o'clock. That'll allow us to find it here a little bit easier. And there's our stitch at 6 o'clock, so we can make sure the belly button is not twisted when we anchor it. So I've marked out the new size of the nipple areolar complex. That's the new size. You can see some pigmented tissue outside that line. We're going to get rid of that. It's important to get rid of that pigmentation with your excision. Otherwise, where your incision line could include remnant areola, and you can see the pigmentation along the suture line. So that's not cool. So basically, we need to excise the old areola and just leave her a new, smaller, improved areola. We're doing the vertical mastexy, which is the breast lift portion. And there are two dimensions. There's vertical, the up and down, north-south, and then the horizontal, east-west. So that's got her a good nipple areola position at 20 centimeters. That's ideally what we want. And that'll pop out through there. And then we're just going to get rid of a little inferior fullness like that. Not too much, but that will preserve the height. So we sat her up and we measured where the nipple areolar complex should be, and it should be right here. So now I'm just going to take out that skin and pop out the nipple areolar complex. So that's how we do liposuction, the upper back, middle back, lower back, abdominoplasty, and anchor mastopexy. Thanks for watching. Please subscribe. We'll see you next time.